comes to this situation.
Yeah,
Thank you, Mark.
Deb. So I'll go ahead and answer from the viewpoint of a health system, specifically Kaiser Permanente. And I want to just start, whoops. And I just want to start with a quote from Greg Adams, who is our chairman and CEO. For far too long, inequality has existed for many people of color, women, the poor, and other groups that have been marginalized in our country. The COVID-19 pandemic has demonstrated the extent of this inequality, with data showing that Latinx and African Americans are disproportionately affected by the disease, as well as by its economic impacts. And we know it's broader than COVID-19. People of color face lower life expectancy, higher rates of diabetes, stroke, heart disease, and cancer. So this is impacting us in huge ways. And I think, Mark, you said humility and vulnerability. And I think the other thing I'd love people to really come to work with is curiosity, and really wanting to understand what is the experience of my coworkers, no matter what color the skin that they carry, what is their experience, and asking about that. I just want to share that, again, the health disparities affecting African Americans, higher rates of heart disease, blood pressure, stroke, diabetes. When they have vascular disease, they have a much higher rate of amputation. They have increased death rates from breast cancer, cervical cancer, prostate cancer. They have higher infant and maternal mortality, lower life expectancy. Imagine living with that, understanding that these diseases that are so common in all of Americans, chronic disease is rampant in our society, but you are, because of the color of your skin, not the color of your skin, your socioeconomic status, the history that you are battling is really put you at a much, you're very disadvantaged as a result of that. What is it like to live with that? Get curious about your coworkers. People are less offended by your curiosity than you would imagine. And again, being part of this community means that we really do understand each other and the burdens that we bear and try to carry them together.
Thank you so much, Dr. Deb. Thank you for bringing up and reading the statement about systemic and historical treatment. I think it really brings the conversation to, equality versus equity and kind of where you stand on that. So that's great. You guys have done a wonderful job of sharing with us both sides from, the medical side of what we can do, as employers and employees to survive during this situation. So I want to thank you both, Dr. Deb and Mark, for joining us today. And I want to encourage the participants to use the online resources that Dr. Deb mentioned, even, after we get off our call today. So thank you both.
Thank you so much. A pleasure to be a part of this.
That was an absolute pleasure and an honor to be a part of that. And I encourage anyone who is watching to please connect with me on LinkedIn. Would love to meet as many of you and, virtual cup of coffee with as many of you as possible. So thank you.
Okay, and if you haven't, please head over. There is a virtual booth again, and I understand there is a raffle happening for people who visit the KP booth, as well as that virtual playbook that's available for how do you reopen your workspace and keep everybody healthy. And again, thank you so much. An honor and a privilege to be a part of this conversation.
And before we hop off here and I make a few announcements, I'd like to ask everyone for a favor. I know that you can't see this because all you can see is me right now, but I can see every single person that's on here. If I can ask you for just a few seconds to turn on your camera, I'd like to take a picture of everyone that's on here. So if we can do that, please. I see you. Everybody's like getting ready. Go ahead, get down with your beds out. Come on, I really want more people on here. Slowly but surely, everyone's getting out of their comfort zone and turning on their cameras. Okay, I see it happening.
Is there room for Q&A? Can we ask questions, or that would not be possible within this format?
We have a few more minutes to go ahead, and if you have a question, feel free to go ahead and ask it now. Mark or Dr. Deb will go ahead and answer it for you.
First of all, thank you so much for great content on both perspectives and to make sure that reopening is done in a safe and easy way. I'm curious to know if, based on the experience that you have and the information you're getting, if testing is a requirement for employees to make the reopening easy and safe for everyone, pretty much.
So lots of conversation around testing. Oops, am I unmuted? I am unmuted, okay. And so we're getting the whole spectrum. And it's actually, again, not necessary, and it, in a lot of ways, doesn't change action. Unless, of course, you have that positive that's asymptomatic, which would be a very interesting thing. Yes, you have that positive test, please go home. But really, if you look at the CDC guidelines, what they're really recommending is the self-attestation along with temperature checks. And there's apps out there. You can also just do a very simple spreadsheet. You can have people just take their temperatures at home and text you and say, I have no symptoms. But making testing a requirement for work is not a very practical thing right now. It's also cost prohibitive for a lot of people. It takes time, money. There are false negatives. One of my colleagues, his wife actually was ill. She actually had 2 illnesses at the same time. Her first test at 2 days was negative for COVID-19. She was actually hospitalized with a different problem. She said, you know, I'd still like to be tested, and was positive on day 4. So a negative test can really give people a false sense of security where I'm negative, it doesn't matter. You could still be infected and spreading the virus. So even if you have a negative test, what are you going to do? You're going to wash your hands, wear a mask, physically distance, etc. So we are not encouraging at this time people to make a negative test a requirement for going to work.
Okay, everyone. So I'm going to go ahead and take that picture. So if you're ready, say cheese, everyone. 1, 2, 3.
Cheese.
Okay, have some people turning on their cameras. Hold on. 1, 2, 3. Printing screen now. And then one more with my phone. Thank you, everyone, so much. Now let me move on to some announcements here. Let me share my screen. Okay, so head over, and what's next? Head over to the expo. Both are where you can connect with resources and live representatives from our BIZCON partners. Check out the networking session where you can speed network with fellow attendees and even exchange virtual business cards to keep the conversation going beyond today. All the expo hall, let me mute you. At the expo hall, be sure to stop by and visit our chamber family booths, including the LA Area Chamber. For information about chamber programs and membership, BIX will exchange the chamber's SBDC, which offers a wide range of free programs and services, including one-on-one advising. Southern California Leadership Network, an affiliate of the chamber, SCLN, offers fellowship and leadership development programs. One final thank you to the sponsors here and supporters, our panelists, and our moderator on here who made today possible. Please enjoy the rest of the day, and we look forward to seeing you tomorrow. Bye, everyone. Thank you.